I am so excited for this next session for so many reasons. Number one, Dr. Chris Sorensen. I've seen his work professionally, and I've also seen his work in yoga professionally, and it is amazing. We are ready for this session on day 3. We are powering through our day, and you are going to love this one. Dr. Sorensen, thank you for being here.
All right. Thank you, Dr. Heald. So yes,
Wait, you everyone. You need a much better introduction than that. Let me give you the long one. Hold on just one second. Let me tell this audience about you. Dr. Chris Sorensen serves as an associate professor and lead faculty in the Department of Education and Liberal Arts at the University of Arizona Global Campus. He earned his PhD from the USF, University of South Florida, in curriculum instruction with an emphasis in instructional technology. Prior to earning his PhD, Dr. Sorensen earned his BS in biology from USF and his MA in teaching from Florida Southern College. Dr. Sorensen began his career as a high school science teacher in 2005 and has been involved in higher education since 2011. In addition to his work at UAGC, he's a certified yoga instructor, enjoys playing tennis, and loves to travel. Without further ado, I am so excited for this session. Dr. Chris Sorensen, the floor is yours.
All right. Thank you, Dr. Heald, for that very warm welcome. And thank you, everybody, for joining me this afternoon. I am certainly excited to be here. So we're gonna go through a handful of breathing techniques, a couple short yoga routines that you can easily integrate into your daily lives, whether it's just for you personally, or if you do want to bring them into the classroom and you can kind of do some breathing and movement with your students. So first of all, the word yoga, right? It's an intimidating word. So I taught a class this past weekend. I teach at a gym, and so I have lots of new members that come in and out of yoga classes, and I can usually spot them. You know, they look a little out of place. But this time I didn't spot this new student because she looked so confident. But she came up to me after class and she goes, "Oh, this is a great class. You know, it was my first class that I've ever taken, and I was so intimidated to take yoga." And you know, I've been there. You know, you're stepping into this new space where you really don't know what's going to happen. You know, you've heard terms like down dog and warrior 2, you know, which means that there's probably a warrior 1, and you're doing all this inhaling and exhaling. So it can be very, very intimidating, but it doesn't have to be. All right. So, and what's great is that just it's amazing how the breath and movement can change how you feel and your mindset. So with that said, let's kind of move forward. So it's going to be okay. Just breathe, right? We've heard that, right? Just take a few deep breaths, calm down. Now there's something to be said about that. Let's first start a little brief overview of the nervous system. So if you think back to maybe high school biology, maybe you took a biology class in college, you may have learned at some point that your nervous system is made up of 2 main components. Okay? We have the sympathetic and the parasympathetic. So the sympathetic is also known as like the fight or flight. It's the one that kind of just like kicks in with all the adrenaline when you're nervous, when you're anxious, when you're stressed. It's the part that's kind of taking over. It can be associated with increases in heart rate, in blood pressure. Most of us probably do not have a hard time stimulating this part of our nervous system, right? We're always go, go, go. We're always we got the adrenaline rush going. It's the parasympathetic or its counterparts that we kind of struggle a little bit more with. So now the parasympathetic, it's the rest and digest. So it's the part of the nervous system that just tells the brain that, hey, everything's okay. It's going to be all right. And it's, usually associated with that lower heart rate, lower blood pressure, Other benefits, reducing stress, anxiety, and it can refocus the mind. So again, this part of the nervous system is one that we usually have to consciously put some effort into stimulating, right, to calm us down. And so that's what we're gonna do today. We're gonna focus in on the parasympathetic nervous system, specifically a handful of breathing techniques to stimulate that aspect of our nervous system. All right. Now, I will preface this by saying, you know, I am not a medical doctor. Okay. So if you are an individual who has had a history with, you know, intense anxiety, stress, if you're, you know, maybe pregnant or have any kind of pre-existing health or physical conditions, you definitely want to consult with your medical professional, you know, your doctor, before you kind of take on any kind of new breathing or physical exercises. Okay. So if that is you, you know, feel free, you know, just kind of sit back and you can kind of just absorb, take it all in, think about everything that's being presented here. If you're feeling confident that you can kind of move forward with this, I encourage you to participate. Okay. So that's, we're going to go through some of these breathing techniques to start. So first technique, known as belly breathing. Okay, this is going to be the easiest, probably the easiest one that you can implement, very effective. So let's practice. Now, obviously you don't breathe into your belly, right? You breathe into the lungs. We call it belly breathing. It's because we are taking deep breaths. We are drawing the air down into the lower lobes of the lung. And then by doing that, the belly is going to expand. So it kind of feels like the belly is expanding and contracting. So let's start. Take one of your hands and just place it on the upper chest. Okay, so this is going to be the upper part of the lungs. And I want you to take just a few kind of short breaths focused on just drawing the air into the upper lungs, focused on making the hand rise and fall. Okay, so keeping the breath up high. Okay, so just go ahead. Short breaths. Good. Keeping the air up high and then release. Okay. Now just kind of notice, you know, if you want to type in the chat any kind of sensation that you may have felt through that process, right? Taking those short breaths, keeping the air up in the upper parts of the lungs. You know, how did that make you feel? Okay, you feel free to, yes, less tense shoulders. Okay, now keeping the air really short, you know, you may have felt maybe out of breath as well, right? You weren't taking those deep breaths in, right? Maybe you felt like, you know, you weren't getting enough oxygen. Maybe you're feeling a little anxious. Okay, good. Maybe I felt a little out of breath actually doing that. Okay, and what type of signal do you think that's going to send up to the brain if you're feeling anxious, if you're feeling like, oh my gosh, I'm not getting enough oxygen, right? So let's contrast that. Taking the hand, place the hand on the belly. Okay, now this time we're going to draw a nice deep breaths in, focused on making the belly expand, that hand rise and fall. Okay, so when you're ready, just go ahead, start some nice deep breaths. Slow exhales. Focused on drawing the air to those lower lobes of the lungs. Feeling the hand rise and fall. And then slowly just return to that normal breath. All right. Now, how did that feel? Contrasting from the upper lungs to the lower lungs. Anybody? Peaceful? Good. Right, maybe relaxed. Okay. You probably didn't feel like you were struggling to get enough air, right? And all that took was just slowing the breath down, making sure, you're conscious, right? You're very conscious about what you're doing with the breath. Okay, so there we have our belly breathing. Our next type of breath is known as sitali. Sitali, also known as cooling breath, the cooling breath. So a lot of times when we're angry, when we're upset, anxious, nervous, there can actually be a rise of the body temperature, right? So this is a breath that can kind of help to counteract that feeling. And it's going to focus on how we orient the mouth. Now you can do this breath one of two ways. If you can curl your tongue, and there's a genetic component. Not everybody can curl their tongue, but if you can curl your tongue like that, okay, you can take that orientation. Now, if you can't curl your tongue, then you can just kind of purse the lips together, almost like you were going to whistle. Okay, so in either case, what you're doing is you're creating a really small opening, and then we're just going to breathe through that opening. Okay, so if you're participating, pick one of these orientations, either curl the tongue or kind of purse the lips, and just start taking some nice, slow, deep breaths through that small little opening that you've created. Maybe one more. All right, and relax. So, did anybody notice that the temperature of the air, it almost felt cooler as it was going in and out of that small little opening that you create, all right? So the sitali, or the cooling breath, is another, again, very easy, right? Just depending on the orientation of the mouth, way that you can kind of integrate that breathing, stimulate that parasympathetic, that calming aspect of the nervous system, okay? Finally, and this is the most involved one, known as Nadi Shodhana, okay? But you can also just refer to this as alternate nostril breathing. So alternate nostril breathing. So start with the right hand. So traditionally it's done with the right hand. And again, usually, or I should say traditionally, you'll take the pointer finger and the middle finger and you bring them down. So you create this orientation of the hand. And what you're going to do is you're going to end up using the thumb and the ring finger to kind of go back and forth between the nostrils. Now, if you have a hard time making this type of orientation, you can really use any two fingers, right? You can just use the thumb and any one of these guys, right? Just to go back and forth. This is just the traditional. And then I usually kind of like to rest my elbow on my arm, right? Just for extra support. So I can keep my shoulders nice and relaxed. All right. So what we're going to do is we're going to start by taking the thumb, closing the right nostril. Okay. You're going to breathe in through the left side, close the left nostril, breathe out the right. Breathe in through the right, close the right, breathe out through the left. In through the left, close, out through the right. In through the right, close, and out through the left. And just relax. So you can see that one took a little bit more kind of focus, right, of the coordination, really kind of thinking about what you're doing. All three, you can integrate that. I mean, you can do them yourselves, bring them into the classroom, have your students, right? The belly breathing, really being able to have that tactile difference, right, is very beneficial for students so they can understand kind of where they're drawing their breath. And again, the belly breathing, very easy. Even the Sitali is a relatively easy one with the cooling breath. The Nadi Shodhana, depending on how old your students are, you may or may not use this. It could be a great technique to use maybe if you're working with more advanced students, right? So if you're looking for a more advanced technique to bring into the classroom. So, right, we talk about differentiating instruction, right? So we have some different levels of complexity with the breathing here that you can bring into the classroom. So 3, I think we could say, pretty easy ways to incorporate some mindful breathing. That's the thing, right? It's like you're thinking about it. It's intentional with what you're doing, right? Because we breathe normally, right? We sit here and we breathe, right? But when we start to mindfully breathe, that's when we can begin to influence kind of how we're feeling and really bringing in that sense of calm into our lives that so many of us are always needing. Right. So moving forward. So movement, mindful movement, right? We all move. So yoga by definition it's the joining of the mind, the breath, and the body. Mind, breath, body. Okay. So what does that mean? Well, it means that you're thinking about what you're doing. You're thinking about how you're breathing. You're thinking about how you're moving. And you're focusing the mind in that moment, right? You hear that phrase, being present, right? We use that phrase a lot in yoga because our minds are all over the place. So if we can bring our attention to something specific, in this case, like breathing and movement, we can kind of remain present in that moment, okay? So we're gonna do 2 short routines here, one seated and then one standing, okay? And these are routines that you should be able to, anywhere from probably 2 to 5 minutes, depending on how long you want to go through the movements, okay? So I'm going to just kind of a little bit here and go back just so that you can get a good, clear view of myself, okay? Easy seated routine. Start with how the body is aligned. Okay, we're going to sit tall, look down at your feet, make sure that the toes are faced forward and that the ankles are directly underneath the knees. So we're looking for nice straight alignment. Okay, sitting tall. Okay, we're going to inhale, reach up with the right hand, gently place the right hand on the left side of the head. And just very gently draw the right ear down. Relax the left shoulder. Good, slowly release. Bring the head back up to center. Okay, inhale, left arm goes up. Place it on the right side of the head. Gently draw the left ear down. Good. Make sure that right shoulder is nice and relaxed. And slowly release. Good. Sitting tall. Inhale, expand the arms out. Open up the chest. On the exhale, right arm swings across. Okay, with his hook. Bring a little bit of rotation to the right wrist in one direction. And then rotate in the opposite direction. Then just open and close the hand a few times. Good. On your next inhale, expand, open up the chest again. On the exhale, left arm comes across. Again, bringing some rotation to that left wrist now, one direction. And in the opposite direction. And then open, close. Good. And then on your next inhale, again, expand out and relax. Okay. Sitting tall, we're going to bring some motion to the torso with some twisting. So you're going to inhale, On the exhale, gentle twist to the right side. Now, whenever you twist, you want to make sure that you're twisting at the waist. So you're not trying to bring the neck all the way around. Relax the neck, bring all of the attention to the torso. Good, slowly release. All right, inhale, exhale, take the twist to the left. And then slowly come back to center. All right, with the left foot firmly planted on the ground, we're going to go into a figure four, taking the right leg, bring the right leg up, crossing, creating this figure four stretch. So we're moving into stretching the hips, right? This is one of my favorite stretches for all the sitting that I do. Now, depending on how tight your hips are, like my right hip is actually tighter than my left. And you'll find that parts, like one side of the body may act differently than the other side. So you may feel a stretch right here, and this may be all that you need. All right. Now from here, if you do want to deepen the stretch a little bit more, sitting nice and tall, just begin to lean forward, okay, drawing yourself forward with the chest so we're not hunching over, right? Long spine, bringing the chest forward. You can probably begin to feel a little bit more of a stretch going into that right hip. And slowly come up, we'll switch. Okay, firmly planting, right foot on the ground, sitting tall, left leg comes up. Create that figure four. Okay, again, you may feel enough of a stretch here. If you want to deepen the stretch, maintaining that nice tall spine. Slowly moving forward with the chest. And we'll bring ourselves back up, release the left leg, and there you have it. So a very quick seated routine. You can see we started up at the top with the neck, worked into our shoulders and our wrists, down to our torso and hips, okay, from the top to the bottom. So let's do a quick standing routine, okay? This one's even gonna be probably even a little bit quicker. So again, let me orient myself here so that you can get a good view where I'm at. Okay. So if you're participating, you're going to start by standing tall. Okay, look down at the feet, toes are pointed forward. Legs are about shoulder width apart. Okay. On the inhale, we're just going to draw the right ear down to the right shoulder. Exhale, draw the chin down to the chest. Making your way over to the left side. Inhale. On the exhale, chin to chest. Back to the right. One more time, inhale. On your exhale, chin to chest. Slowly back to the left. One more inhale. And then on the exhale, slowly return. Good. And then we bring the head back up to center. Okay. Begin to just gently rotate the shoulders in one direction. Okay. And then we'll switch, take it in the opposite direction. Good, and slowly bring those shoulders to stillness. Taking the hands, clasp the hands together, intertwine the fingers, and then we're just going to bring a figure eight motion to the wrists. So if I were to come in to show you kind of what that looks like, this is what we're doing here. And then we'll switch, take it in the opposite direction. Good. And then slowly release. All right. Hands on the hips, bring some rotation to the hips in one direction, right? Think hula hoop here. And we switch it in the opposite direction. And slowly come back to stillness. For this last movement, we're going to put the feet together, bending the knees, placing the hands on the knees, and then you're just going to bring a little gentle rotation to the knees. This movement here, we're kind of working both the knees and the ankles. We'll take it in the opposite direction. And then slowly come back up to standing. And there you have it. All right. Rejoin you back up here. So 2 very easy routines, kind of one seated, one standing. You can see, depending on how long you go through each movement, you know, I would say, you know, give each movement at least 20, 30 seconds. And then if you want it to go longer, if you know, you're going to find that you're going to have favorite movements, right? So you're going to want to be there for a minute. Like when I work my hips, I want to stay there. So you can kind of play around with the time, and you don't have to do the entire routine. So if you wanted to integrate this into the classroom, this could be, right, we're always trying to integrate kind of like brain breaks or movement breaks with our students. So you could just kind of focus on one movement. So say your kids are working on an art project, something like that, and it's time to transition to counting, right? So you need to make that successful transition between the 2 activities. Most kids probably aren't going to want to go from, you know, coloring over to math, right? So yeah, have them clean up. You have them all sit up nice and tall and say, okay, let's rotate out the shoulders 5 times in one direction. Okay, let's count. 1, 2, 3. Okay, now let's switch other direction 5 times, right? You do your 5 movements, and then that can be it, right? So it can just be a really quick movement activity to help your students kind of transition, because by going through that process there, all of a sudden they're taking their mind from what they were doing. Okay, now they're focused, they're doing something here, right? And now you can take them on to the next activity, right? So you get them moving a little bit, and then at the same time, you kind of help them successfully transition between activities in the classroom. So there you have it. Just a couple minutes left before we're at the top of the hour. Yeah, some easy breathing techniques, movement, definitely integrate it, you know, define it. And it doesn't have to, like I said, yoga, it's not intimidating. It doesn't have to be intimidating. It doesn't have to be long, right? Very simple. So yourself, your kids, hopefully you're taking something away that you can use, right, in your daily life. So with that said, I think if there are any other questions, comments in the chat, I will pass the mic back over to Dr. Heald.